All right. Hello, everyone. Good evening. My name is Dylan Rivera, and I'm the Senior Digital Marketing Manager at Aerolase. And we want to thank you all for taking the time to join us this evening. So we have a special presentation lined up for you that is centered around going beyond standard procedures, how Aerolase treats acne, melasma, rosacea, and rejuvenation differently. So before we bring out our featured speakers, we do want to encourage everyone to write in the chat. Let us know where you're tuning in from. Also, this is a recorded session, so we will be sending out the recording midday tomorrow to everyone that is currently watching, as well as anyone that has registered. And we will be conducting a live Q&A session at the end of the presentation. So please put all questions in the Q&A section, and we'll make sure we cover your question. So with all that down, let's go ahead and bring out our featured speakers, Jody and Dana. All right.
Hey. Hi.
Hey, Dana, how's it going?
Good.
Awesome.
Hi, everybody.
For joining us this evening. So we actually have some people writing in the chat, joining us from Michigan, Virginia, Seattle, New York City, Washington, Florida.
Awesome.
Wow, all around the country. So very, very cool. So Jody, before we get started with the presentation, maybe you can tell the audience a little bit about yourself, since tonight's topic, we are going to be diving into different technologies and how they treat all those indications that we mentioned earlier. Maybe you can give us a little bit of insight into sort of your background and what that looks like. And Jody, we can start with you.
Sure, of course. Welcome, everybody. So I'm Jody. My background is I'm a nurse. I started in ICU for about 20 years until I got into aesthetics about 2018. And I still currently work at Strella Aesthetics, which is outside of Philadelphia. And I work there 3 days a week. And about 3 years ago, I started training with Aerolase. So I do that about 3 to 4 times a month, and I love it. So super excited about tonight to kind of share some of my wisdom.
Great.
And Dana?
Awesome. Hi, everybody. I'm Dana Greenhall. I am a licensed esthetician. It's actually a second career for me. I was in marketing for both pharmaceutical and actually at a university before I was a stay-at-home mom, and fell in love with aesthetics as a patient and decided I wanted to pursue this as a career. And I've been doing this for almost 20 years now. Was working majority of my time in dermatology practices, where I did everything involving skin, and majority of the laser treatments for our practices. It was at a med spa at the end of my career where I met Jody, end of my treating career, I should say, at Strella. And then we started teaching some laser physics courses and other skincare courses. And now I train for Aerolase. I've been with Aerolase for 4 years and exclusively train nationally throughout the country. And love it.
Awesome.
Yes.
We are definitely very lucky to have both of you joining us this evening and sharing your expertise and breaking down all these different technologies as we get into sort of the specifics of each and how they treat those different indications. So everyone in the chat, I saw one chat saying they're having some audio issues. Give us a thumbs up if you can hear us okay. We definitely want to make sure that everything comes through good on your end as well. So we'll keep an eye out on the chat for that. And one thing before we actually bring the, okay, awesome. We see some thumbs coming in. Very cool. Before we start the presentation, we are going to be throwing some polls in during the webinar, and I'll share the first one now. And with those, we'll go over the results midway through the presentation. But this will also give us some insight into sort of what you're all experiencing, and maybe we can even address some of those questions towards the end. So with that, let's get started with the PowerPoint presentation. Here we go. All right, so like we know, we're diving into the topic of beyond standard protocols, how Aerolase treats acne, melasma, and rosacea differently, and we're also going to talk about rejuvenation as well. So to get started, we'll dive into the science behind wavelength and pulse duration. And with that, Jody, why don't you start us off here?
Sure. So with pulse with the pulse length, or I'm sorry, the wavelength. So there's two things that basically are determined. So with the wavelength, it is going to determine what chromophore the laser is seeing. So whether it's hemoglobin, melanin, or water. The other thing that's really important with the wavelength is the wavelength determines the depth of penetration. So how deep it's going into the skin. So typically with your, the wavelengths up to a 1064, the longer the wavelength, the deeper it's going into the skin. So a 1064 is going to go deeper than the 532. Those are more superficial. And then, of course, you have your fractionated lasers that see water that are more superficial than the 1064.
Awesome.
Great.
And
Yeah.
with that, we'll dive into pulse duration, and maybe Dana, you can lead us through here.
Right. So pulse duration will be the amount of time the laser actually spends in the skin. So it's the measurement of time in a sense. So there's picosecond, nanosecond, microsecond, which is what Aerolase is. Picosecond is like 1/1,000,000th of a second. So those lasers are very quick and sporadic and doing more of a pulsing technique, where Aerolase as a microsecond, we are 1/1,000,000th in time that we are in the skin, but we are in and out, but not as a pulsing, almost like a sledgehammer, you can picture picosecond, but we are consistently building heat at a microsecond pulse width. So the amount of time that the laser spends in the skin is very important to be able to treat everyone, because longer pulses and pulse widths that cause more heat and trauma to the skin can be more detrimental in the long run for your patient. So we are a short pulse in microsecond as 650.
And I think it's probably even safe to say too that these are kind of two main factors, or maybe even differentiators, for all lasers, and sort of how they sort of affect the skin and the certain indication you're probably looking to treat.
Mm-hmm.
And with that,
important.
and a common misconception that I think we all kind of see, that at least we've heard around, 1064 is 1064. That's not exactly true. Same wavelength plus different pulse duration equals completely different treatment. Shorter pulse equals better, more advanced. And I think a big thing we want to everyone to kind of walk away with here is seeing that, obviously lasers do different things based off of those factors we just mentioned, but also some lasers do some things better, some lasers that don't necessarily. Like, picosecond is better for tattoos, but it may not be the best for acne, melasma, rejuvenation, which, Dana, Jody, you guys are both going to dive in. And, with this, we have a little bit of a breakdown of picosecond and Q-switch that maybe, Jody, you can walk us through.
Sure. So yeah, the picosecond, that is causing like a thermal mechanical injury. So it's like shattering the ink, it's shattering the pigment, which in turn can cause a lot more damage, because those melanocytes are very, fragile. So if we are too aggressive, then we risk, causing PIH, hyperpigmentation, especially in the darker skin types. So have to be careful with that.
Right.
And Dana, for long pulse, maybe you could walk us through that.
So a long pulse, like, and back to that comment Dylan made, 1064 is a 1064. Well, there are long pulse 1064s out there. And again, that means probably more of a millisecond pulse width, where they are spending more time in the skin before they come out. And by doing that, there is a chance to be causing some more damage, not only in the dermis, but epidermally, because the heat is building to a point where the skin will view that as a little bit of a trauma. So the difference between a short pulse and a long pulse will be the amount of time it spends in the skin. And again, picosecond is so fast, you would think that's a really short pulse, but as in the sledgehammer kind of effect, like Jody was mentioning, that phonomechanical, that can cause trauma, which can cause issues, whereas a long pulse will cause more heat-induced concerns within the skin.
Right. And usually with that long pulse, it requires like cooling. So
cooling.
With laser hair removal, there's cryogen that's being, cooling the skin so that it can go deeper and stuff like that. So
cool tips, you would have to have, you could put, for comfort, some of the lasers have actually tips that are cool. There's cryo, which is consumable. There's, maybe adding another machine for cooling. So, right, because of the heat on not only the internal, but the top of the skin that the patient will feel.
Right.
Right.
Awesome. And, I think now we can dive into sort of a spectrum of pulse duration. And Jody, maybe you can get us started.
Yeah. So the pico wave, like I said, is going to cause the thermal mechanical injury. It's going to shatter the ink dye, and it's going to really target that pigment, which, it has its limitations, especially, on the darker skin. You have to be careful if, someone has had sun exposure, causes a lot more trauma, causes some inflammation. And then the Q switch, which is a little bit, newer technology from the picosecond, it still, again, can cause that mechanical injury. It does break up that melanin, but ultimately there's that higher risk of that PIH for when treating darker skin and stuff.
Gotcha. And, Dana, you did just actually walk us through the long pulse too. So maybe you could break down the microsecond, the Aerolase, pulse
Well,
duration.
yeah. So as a microsecond for Aerolase, as a shorter pulse with a 650 microsecond pulse width, again, we will be in and out of the skin at a faster pace than a longer pulse laser. So that will help mitigate any potential epidermal involvement, obviously because of our wavelength as a 1064. But then the heat is building almost silently as we are moving the laser around the skin. So you almost don't feel the heat until we are more through the treatment than when we just start. Where a long pulse laser, you can almost feel it exactly when it hits your skin. Where microseconds, it takes some time to build that heat because of the time in and out of the skin. So again, there's less need for cooling because the skin is not necessarily registering the heat as fast as we are doing the treatment. So.
Gotcha. And I think that's honestly a great transition to our next slide. The cooling requirements tell the
Cooling,
story. And like you
Right.
mentioned, the aggressive cooling and so on too. Maybe you can tell us a little bit, Jody, on your end about some of your experience with some of the other lasers and how cooling plays a part throughout it.
Right. So specifically with the long pulse YAG, there's usually cryogen that the cryogen, disperse first, and then milliseconds later is the actual laser. So, but if you didn't have that, then it would cause a lot more discomfort. And then with IPL, BBL, there's usually a cooling tip. So it's like contact that has a little bit of a cooling effect with that as well. And yeah, there is a consumable with the cryogen. So, you have to replace those, and sometimes they're faulty and stuff. So it's always nice with the Aerolase because it's more comfortable.
Right. Yeah. And there's also like in piggybacking off of Jody, because of the heat that those lasers you put in the skin, there's a little bit more trauma and downtime to the skin post-treatment than an Aerolase or a shorter pulse laser that doesn't necessarily cause that same amount of heat-induced edema or post care that's required after those lasers.
And I've even treated someone with a long pulse YAG, and you get like little cryogen burns. So you get those little moon-shaped cryogen burns, all of your legs if you're doing laser hair removal. So the technique a lot of times has to be very precise.
Right.
That makes sense. And I'd assume probably the downtime and the pain associated could be some pretty big components on whether or not a user tries for a certain treatment or even comes back for one.
Right.
Yeah.
Right.
Right. And the goal is whatever you are using the laser for is your end goal. So some people will grin and bear through some very uncomfortable treatments because they want that end goal. But the treatments don't always have to be that uncomfortable. So yes, there's going to be a response, but doesn't always have to be a response of discomfort.
Right. And I always say that even with the Aerolase.
Yeah.
It's not painless.
The laser.
So it's a laser. You're causing a lot of heat, and
Yeah.
a lot of the times when it sees more chromophore, so if it sees a lot of that inflammation, the redness, you're going to feel it a little bit more. And some people are uncomfortable, so I'll give them a fan to hold on to and stuff like that. So
yeah,
but yeah,
right.
just
Yeah, we are a laser. I mean, obviously, and depending on what Aerolase is, whatever the treatment is, the patient is seeking in their treatment, the laser is going to see all the chromophores, right? Because we see multiple chromophores at once as a 1064. So
right.
if our patient is presenting with a little bit of everything, melanin, hair, skin, vascular, the laser will see all of that. So it could still feel like a laser. Now, as a short pulse, it's a little bit more comfortable. Rarely would you need to numb or add cooling, but it's not going to be the end all if somehow you have to give everybody a little bit of a break, or like Jody said, add a slight fan, or sometimes ice them before you do the treatment, because that can help mitigate a little bit of discomfort. But on 90% of the patients, that is not going to be necessary. Probably 99%, but realistically.
Awesome. And with that, maybe we'll take a look at comparing erbium lasers versus CO2. And Jody, you can get us started here.
Sure. Did it switch? There seems to be a little glitch.
Oh, let's see. Is that better?
Yeah. Did yours switch, Jode?
No, it still says cooling on my end.
Oh, okay. Hold on. Let's see. Let me try something here.
Because I can see mine.
How about now, Jody?
Oh, okay. Now I see it.
There we go. Cool.
All right, awesome. So yeah, so with ablative lasers, the fractional CO2, this is a little bit more aggressive. It can have some more drastic results, but it's requiring, 7 to 14 days of recovery. It's causing a lot more deep thermal injury, especially in the dermis, and it's vaporizing columns of the tissue. So yes, it is great for like those really, really deep wrinkles, scars, but it comes with a little bit more downtime than the ERA. So the traditional YAG, there is also the 2940. Again, that's going to have a little bit more downtime. And then the Aerolase ERA, which is a short pulse. So that's the 300 microsecond technology.
Right.
And the nice thing with that is you can kind of customize the aggression with that. So you can have anywhere from like 1 to 3 days of downtime and recovery. And it's safe on all skin types, 1 through 6, which is really, really nice.
Yeah. And erbiums are usually more absorb into water in the skin better than the CO2. So they do more of that vaporizing of the epidermis than CO2, which does have a higher pulse width, but the erbium YAG is usually more effective in just a gentler downtime and a gentler treatment overall. But we, like Jody said, can add and change energy output to make it more aggressive if we need to. So you have the ability to be both simple and aggressive. And the lack of demarcation is huge. So you can just treat body parts or facial areas, just the eyes, just perioral, and not worry about any demarcation across the board.
Right. So here we can take a look at an illustration of the depth of ablation. Jody, can you tell us sort of what we're seeing here?
Yeah.
Yeah. So I mean, with the it's showing like the thermal effect here. So let me see. With the 600 microsecond, you see the ablation and then the coagulation. So unlike, like Dana had said, with the CO2, that's actually causing injury to the epidermis and the dermis. So
Right. And you can see where the tissue is being compromised at the farther wavelength, like the continuous CO2 compared to our short pulse. So again, less thermal damage overall for healing and potential risks of some of these ablation treatments.
right.
Dana, maybe you can walk us through sort of, why arrow lasers don't cause sort of that collateral damage too.
Right.
You'd have sort of been mentioning it, but.
Yeah, and exactly what we were saying. The 2940, it's well, we were saying here 16 more times efficient in water absorption versus CO2. And that is really what ablative lasers are doing. They are being absorbed into the water of the epidermis to vaporize it, which in turn causes it to die. And then eventually it will peel or slough off, or depending on the depth that we are going to do, really do some changes on the epidermis for fine lines and wrinkles. We can take care of some pigment and some concerns that are in that epidermal layer in which we move. But with our pulse duration of 300 microseconds and the repetition rate, we can go up to 1.5 hertz. We can avoid overheating the skin, which could cause some residual post-inflammatory issues. And that is why, and erbium really can be used for everybody. We can ablate 1 through 6s because of the ability to designate how deep we are going to go so we can be safe, but at the same time, we can be aggressive for the Fitzpatricks and the patients that we can be aggressive for. So it does make it safe again for everybody. So, which is huge.
Right. Yeah. And yeah, we with Aerolase, with the Era, we have like a specific protocol that we follow for the darker Fitzpatricks, so that we're, not necessarily doing overlap, we're doing lighter so that they don't have that risk of like PIH.
Exactly.
Great. Yeah. Hey, it's a customizable treatment that's effective and I guess the number one priority, safe for all skin types.
Yeah, always.
So with that, we're going to go ahead and close our first poll, and we're about to jump into sort of treating different indications that we mentioned. And with that, it seems like a wide majority of our users are most frequently treating melasma and hyperpigmentation, with about 70% of the votes, and second place coming in is anti-aging and rejuvenation too. So I think we have a lot of good insights that we can that we're about to share with you. And with that, we'll go ahead and open our second and final poll. So we'll go ahead and do that now. So please visit the poll tab throughout the presentation, and we'll revisit those results at the end. And from here, Dana, why don't you break down acne for us?
Okay. All right. So acne, and Jody, you can jump in here too. But so when we are working on acne, obviously there's a lot going on, but we are helping with the excessive sebum. We are working on P. acne bacteria. We are working on the follicular involvement, which can cause clogged pores, inflammation, redness. There's some pain associated sometimes with acne. So as Aerolase, again, sees those multiple chromophores, it can treat the inflammation. It helps with the sebaceous overflow or the glands that are overproducing oil, but it will also be able to help with some follicular involvement that is causing some clogged pores because it sees the melanin in hair. So all of that will help with inflammation and redness. Now, acne we know has a lot of layers to it, but this is where the Aerolase will step in to do some things at the dermal level that topicals and other treatments that we are incorporating might not hit, but you can continue to use those while you're using the laser. So the idea treatment will help decrease the acne bacteria. The inflammation will obviously go down. We can minimize downtime because this is not a laser that's going to cause any post-treatment trauma. And again, safe for all skin types. So 1 through 6, all skin colors and all levels of acne can be treated, and with minimal pain and minimal discomfort. So as we get more into the treatment, it can become more comfortable because we can hopefully have less target as we go into our package.
Yeah. And a lot of times with acne, if someone's coming in and they have a lot of active acne, I will bring them in either every week to 2
Yes.
weeks, 1 to 2 weeks apart while they're having that active acne. Then once you start to see that active acne kind of calm down, then I'll space it out, because then if I'm dealing more with like the PIH, the PIE, acne scars, then you want to wait a little bit longer for like 3 to 4 weeks for that complete cellular turnover to happen. Once you've kind of calmed down that active acne.
Right.
And then also, pairing it up with a chemical peel at that same time, like a
Right.
good chemical peel for specific acne and stuff.
Yeah. Acne needs to be hit a couple of different ways, but our laser is hitting it in a way that will, again, help prevent future and take care of what is active now. But other things that we do for them, like a chemical peel, their home care, if they're on medications, they don't have to stop that. So what you are treating them with outside of the laser treatment can continue in their plan, which is really huge.
Right. And then with the Aerolase, so what the Aerolase is actually doing for the acne, so the 2 chromophores specifically that is treating the acne is it's seeing the hemoglobin. So it's helping with that, with the sebum production. It's actually like vascularizing that capillaries so that, it helps with the sebum. And then it also helps to reduce that inflammation. And then it also sees water. So it's kind of causing like a heat conduction. It's bulk heating, and that is going to destroy that P. acne bacteria. And then also, in turn, is going to help build collagen for those acne scars and stuff. So,
Right.
Yeah. So it's also reducing, that sebum that's causing a lot of that acne too.
Yeah, because like as Jody was pointing out, it is very active, but it's also in a preventative state too, because it's helping to prevent some future outbreaks. Now, sometimes we do have to purge, or there is some active response, but that's just how acne really does start to heal itself. But the Aerolase can even work in like with the water and building collagen for a preventative to help prevent some future outbreaks after we get through this whole cycle of flaring.
Right. And I think by far one of the most important things when treating clients with a lot of these conditions are, what is their home care? We could do Aerolase every single week, every 2 weeks, but if they're not doing good things, with their home care, washing their face, using the appropriate actives and stuff,
Ingredients, right.
It's really, really important. So
very important.
Education is huge when it comes to conditions like this.
And acne is not a quick fix. We can get some really good response with some patients quickly, but we can also have some patients that need more time and patience. And that is a huge factor with acne. Good and bad.
And it's like you said, it tackles active acne.
Yeah.
It prevents acne from coming in as well, and there's also the post-acne effects like PIE,
Exactly.
PIH, and scars.
Right.
Very cool. And I think an important thing that we've seen from a lot of our customers, and I'm sure both of you can even attest, is bringing things back to the clinical data.
Yeah, we have a lot of clinical data with all of our, FDA conditions that we treat, and specifically with acne. This specific study with Dr. Sadie, this was done with skin types 1 through 6, and after 3 to 4 treatments, it was 90% effective that people were happy with their outcomes, and it actually improved, and with very minimal side effects, which is really, really good, especially with those darker skin types.
Right.
And, now we're about to show some before and after images, and I'd love both of your input on what you're seeing and maybe even what it takes to achieve some goals like this using the Aerolase device.
So this is a great one,
Mm-hmm.
with a darker Fitzpatrick, and this is after 5 treatments, and she has great clearance still after the 90 days post. And you can see a significant reduction in the PIH that she has, specifically, and a lot of like the erythema that she has. And I will say it is one major thing is to take so many before and after pictures. I take pictures before every single treatment so that I can show the clients, their progress, because sometimes they're used to looking at themselves all the time and they don't necessarily see improvement until I show them that before and after, like, after 3 sessions or after 4 sessions, and they're like, wow, I didn't realize how bad my skin was. So
Right.
it's huge.
Really important. And here's an example. Obviously, this is a lot of what we would see with somebody who is in an active stage 3, almost stage 4 acne outbreak. And this is after 6 treatments. We help the erythema, we help the inflammation. This is always, it's going to help with the active pustules as well as the cysts. And acne it's a 2-step treatment, right? We can bring them in every 1 to 2 weeks, but we are going to treat the skin as a whole, but then we are going to treat each individual active lesion too. So that's a really important step to make sure that you are putting more heat into what is active to help calm that down. But treating the skin as a whole does all of that coagulation with the heat and the inflammatory hemoglobin. But then going back and treating each individual active acne is really important also. So following that protocol, which has the 2 steps, really can help in the long run significantly.
Right. And again, with this one, this is after 6 treatments, and you're seeing a huge reduction in the erythema, the pigmentation that she has,
Right.
and just the overall skin texture is so much improved.
Right. And very common, both PIH at the same time as active acne, right? So she's probably had some outbreaks that are healing, because acne is a controlled wound in a sense. It is active, and there was trauma to the skin, but both her PIH and the active are being addressed by the 1064 wavelength. So
Right. And then again, the erythema, the just so
and of
much
course
smoother.
for the man, it took a couple more treatments, right? 7 treatments here, but
Yeah.
that they have definitely probably a little bit more oil production sometimes than women. There's definitely some more hair involvement in a bearded area, but this is definitely working in the anti-inflammatory and the active pimple response.
And for our final acne before and after image, I think we wanted to show that it's obviously can be used across different areas of the body too for the specific indication.
Yeah. So this was chest, and I know I've done like back before, and it works great anywhere on the body.
Yeah, we always say head to toe, right?
Yep.
Anywhere. So anywhere there's skin.
It's treatable.
Yes.
So we'll oh, I'm sorry. Go ahead, Dana.
No, I was going to say, like, the comparison here, I took your spot there, Dylan. I jumped ahead. But there's, again, a lot of different wavelengths and lasers out there that we can use to treat various concerns, right? So, but they all require different things. Some require some consumables, some require some topicals, some require some extra add-ons to the actual laser. Like an IPL, you would have to use gel. A long pulse or the 1726 might be some numbing that could be a little bit uncomfortable. So these will all be things that we use, but cooling might be required. Only can treat Fitzpatrick 1 through 3. safely. So you can't treat everybody. Downtime might be 1 to 2 days as compared to none. So sessions needed could be multiple, 10 compared to 4 to 6 to at least get it under control. So, and session times also could be an hour running compared to a 20-minute session, depending on areas that you are treating. So the comparison is very easy in time and add-ons and things that are needed to run the actual laser to do the actual treatment. Of course, everything is patient dependent. And, you know, sometimes it might be longer for a patient that might have been like that one slide we had, which was really red and inflamed. But on a whole, this would be kind of an overview of the comparison.
And from there, we'll move on to melasma and hyperpigmentation, which we know our audience is definitely interested in learning more about.
Oh, melasma. That fickle friend. You know, melasma, and Jody will jump in on this too, because, you know, we both suffer some of these things that our lasers do. But melasma is, it's hormonally based. It is definitely lifestyle can be a contributor. The melanocyte hyperactivity is really a factor, and a very high reoccurrence rate. So we are treating symptoms of something that is going on internally in the body. So we are going to target the melanin, but we also are going to target the hypervascularity that is a huge component of melasma. But we will see it at the dermal level. And by treating that and the hypervascularity, we can hopefully mitigate and control what will be at the epidermis. But the wrong laser used for melasma can stimulate more pigment and make it worse. So,
right. And especially with the pico way, you know, it can cause, like I said before, the melanocytes are very fragile cells. And when you're causing this mechanical injury, then it can cause a lot more damage to those melanocytes, causing an inflammation. And then inflammation is not good for melasma. It doesn't like that. So then in turn, you can actually have worsening hyperpigmentation than when you started with. So that's not the goal with melasma.
No. Yeah, and I think when we address both melanin and vascular, we can hopefully have a longer span without any reoccurrence. So there's so many things that are a factor of that, but by addressing so many different levels, like in this slide here, because it targets epidermal and dermal in the sense that we are heating up the dermal melasma to come to the epidermis. But the goal is to not overstimulate and heat the epidermis so that they want to live there. Because when heat is involved with melasma, it makes it come out and say hello. So it just depends on lifestyle and what's going on in, you know, the heat and where you are. But by suppressing that inflammation, back to inflammation, it will help to control how much is responding to the negative aspects of a treatment. So, but our goal is to not overheat it. And it's really something when we are treating with our laser that you want to watch. You want to watch the response. Sometimes it gets darker. Sometimes it actually looks like it's lightning. But after we take the heat off, that melasma can kind of start raising. The pigment can start finally coming to the surface. So it's really a treatment that is going to be patient dependent and watching how your patient is responding to the treatment.
And when I treat melasma, a lot of times with the Aerolase, I will do like one complete pass all over the face, unlike doing, you know, other treatments where you're kind of bulk heating and doing, you know, 4 to 6 passes on one area on the cheek and then moving to another. So I will do one complete pass all over so that it doesn't necessarily bulk heat or overheat. And there's times if I notice any erythema, I will give them a fan to hold on to just to kind of help to cool them down in between.
Mhm. Right. And even like Jody said, sometimes it's only doing a few passes on one side, moving to another, and then maybe even coming back and hitting just that melasma area. If we're doing a whole rejuvenation, but they also are dealing with melasma, we can break it up that we don't overstimulate the melasma, but can still treat the other areas of the skin. So it is kind of a watch and see and how they're responding.
And like always, we like to bring it back to the clinical data. So this is a two-parter where we're just kind of breaking down the clinical data of a recent study around melasma.
Right. And this was 10 subjects, right? They were treated for every 2 to 4 weeks. So sometimes they were bringing them in a little sooner than that traditional 4. Skin types were 1 to 3, and they were treated with a mode of 4, which is a lower mode. And then the 4 to 6 were treated with a mode of 5. So sometimes less energy can also be something that we can tweak compared to the normal energy we'd put in their skin for other things. So sometimes it doesn't have to be the highest amount of heat to get that change. Sometimes it can be a lower amount. And lightening of the melasma occurred at 3 weeks post-treatment. So again, it took multiple treatments to see it. They weren't seeing it right away. It was happening after their treatment. So sometimes it is a little bit of a patience game. We're not going to see that change immediately. It might take some time for all the inflammation to really suppress. But the majority of the subjects were 25% improved after 2 treatments. And then by the third, there was no, and no pain or discomfort during that, which is really important, especially for our 4, 5, and 6s. And then and essentially there was no pain, no downtime, lower risk of rebound we're finding if we do kind of work at the dermis, and the ability to treat everybody. So that was a huge part of the clinical study.
So let's take a look at some before and after images and tell us what's going on here. What do you both see?
I see definite brightening, especially on the sides of her face. That
Right.
pigment has really kind of subsided. And, some people don't realize they even have melasma because, they're like, they just think it's sun damage. But most of the time, melasma kind of mirrors itself. So it's on both sides of the face. But yeah, her skin is brighter, especially around like the temple area too. That's a very popular place for the melasma.
Right. Yeah, melasma is kind of a mirror image of each other in a sense. Might not be exactly the same, but usually covers similar cheek, similar jawline, similar temporal area. So that makes it a little different than a solar pigment. And it's usually more diffused. So definitely brighter after 4 treatments. And same with this one, again, 4 treatments, definitely right there in that jaw and that cheek line. Definitely worked on brightening. And you can even see there's a little bit around her mouth. There, again, it's not completely gone, but it is at a point where she is probably very comfortable with what she has to deal with. Easier to cover, easier to protect. So that's always a win because again, melasma is a very, difficult long-term condition.
So at that point, you probably both would recommend that this patient would keep coming in for treatments and keep kind of chipping away.
Yeah, and home care is really important. They need to use some like tyrosine inhibitors, something that is suppressing some of the melanocytes. This is going to be a consistent treatment plan. It's not like I'm going to get your melasma into a place of suppression and then you don't ever wear sunscreen and you don't ever use skincare again. This is a treatment plan for consistency that they will have to be a part of just because of what melasma is and how it can respond. So being really compliant with their sunscreen is super important because any sun can stimulate that heat response.
And even just knowing like the triggers with melasma, because
Right.
yes, it's sun, but it's also that heat. So,
Internal
exercising, doing
heat.
hot
Yeah.
yoga, things like
Yeah.
that can really, really exacerbate that. And a lot of times people don't even realize that. So it's not necessarily just the sun. So there's so many other factors. And
One of my
again,
hardest cases, she was in the military. She was like an Iron Woman marathoner, those people that are out for 10 hours or something. And she was also on birth control. So we were dealing with a lot of factors, and lifestyle changes kind of had to come into play for her because she was really a severe case of melasma. It took a good 2 years to get us to a place where she was comfortable. And that was going to be ongoing for her. But yeah, there's a lot that can feed it. And these are just more great examples. 3 treatments, definitely some brightening. And again, probably we'll need a few more treatments, but we are starting to see a little bit of a light at that end of that tunnel for her.
And then, we kind of talked about, I always stay away from anything light-based because that's going to make melasma worse. IPL, BBL, I, will not do that with my melasma patients. I, always go to the Aerolase because it's a less heat, safe for all skin types. So it's not causing
and the
any
light base is right on the epidermis, right? It's putting all the heat to the top of the skin. So then the trauma response is to feed that, and that's where it can make it worse.
Right.
So.
And with that, we'll move on to rosacea and facial erythema and sort of the characteristics and challenges that go along with that.
So if you have rosacea, raise your hand. I have rosacea. It's been on. I was a sun worshiper back in the day, and used a Buff Puff. I don't know anybody in this age group, which was pretty much a scouring pad we would use to wash our face back when we were teenagers. So all these things are a contributor, and I fight my rosacea daily. But the chronic inflammation, the vascular, there's the dilated vessels and capillaries that we are treating, sensitivity to food, to drink, to smells, to topicals, and then flushing, that persistent erythema that we can get. So rosacea, again, is another one that is a little bit chronic, but inflammation is a huge factor. So the 1064 with that anti-inflammatory response is a game changer for helping to maintain your rosacea, to keep it in check. It could be a product treatment that is, again, kind of rotated into a treatment plan yearly. But the approach will be to use it to suppress the inflammation, which causes the rosacea, but then it can help coagulate and bust the capillaries that are also sometimes feeders or a symptom of the rosacea because inflammation. When we get into higher stages, we can start getting that rhinopharma, which we're getting more overgrowth on the nose. So by suppressing it, we can help kind of keep that at bay. But when we are working with both erythema and capillaries as part of the rosacea, we can treat both of those with rosacea. Other lasers that, like a 532, really will only treat the vein and vessel aspect. It's not going for the full inflammation that is also going to be feeding the rosacea as a whole. So, yeah, that's kind of in that pulse dye and the long pulse. So requiring cooling, all of those things that are needed, and IPLs can help suppress, but then we can rebound pretty quickly if there's a lot of trauma in your skin by using that heat.
Right. And a lot of times you're limited with skin type for the IPL, and you have to be so careful with sun. You can't have any sun exposure for at least 4 to 6 weeks. So
right.
you have to be really careful with IPL, BBL, light base.
But and on the flip side of this, and I like to say this, is if you have an IPL in your practice, bringing an Aerolase into your practice can actually even be combined with your IPL, because we will treat the inflammatory response with the 1064, and then sometimes coming on top for the right patient and using your IPL right on top is a way to be able to get some other things that both of them can do, but together do really well. So just because you have one laser does not mean our laser can't be a part of it, or you can't add that laser to our laser. So.
And with that, always bringing it back to some clinical studies that we have available. And in this case, maybe Jody or Dana, you can sort of tell us some of these results that.
Yeah, because you see that it was with the pulse dye and with the 1064, so comparative, but 92% improvement after 4 treatments with the 1064, 73% greater improvement compared to the pulse dye after 4 treatments. So again, the pulse dye is treating some vascular, but not the inflammatory response that is a part of the whole rosacea condition.
Right.
Yep.
And then we'll share some
stereotypical rosacea right there. Sometimes you can be in a flare and then the laser can really help suppress it right after. Again, yeah, and definitely some vascular veins in that were in play for him. Two treatments.
Yeah, help him with that. Yep.
Yeah.
And yeah, like you said, Dana, it's like, a lot of times it's just nice to have, a series of Aerolase, because if you have a flare up, you can just come on in and get a treatment. It could be something simple that was in your routine, some kind of stress response that caused that.
And because there's no consumables for our laser, you can do just a section if you want to for them. If they just want you to hit their cheek and nose for a follow-up, or if you've done the whole series, we always recommend you really get a whole series in, but then the laser can be a part of their treatment plan, and it doesn't have to be necessarily a whole area, can be just a part of an area, but you can continue to use this to help keep things in check.
Yeah, and with this client, it's really important. She does have a lot of broken capillaries, so it's important to treat the rosacea first, and then go in and spot treat all of those little vasculatures.
Right.
For your best results.
Yeah, because sometimes even just doing the treatment helps suppress the background noise of the rosacea, so you can see some of those capillaries better. And even some of those other tiny capillaries might even go when the rosacea calms down. So it's really important to do a few treatments before sometimes you actually go after all of the veins right away. And here's, again, IPL, pulse dye, long pulse 1064, 532. They're all targeting hemoglobin. They're all going for the same chromophore that we would be able to treat with the Aerolase, but some are superficial, like the 532 is just superficial vascular. The long pulse can hit deep vascular, but cause some heating that can cause some other concerns. And then the broad spectrum can be inconsistent just because it's only seeing certain areas. It's not going deeper for the inflammatory response like the Aerolase. So again, consumables can be a part of all of this, and some numbing could be necessary. Gels could be necessary. Topicals can be necessary, but realistically, the 1064 short pulse works on a couple of different levels in that rosacea patient.
Great. And we'll cap off our indications with skin rejuvenation, the goal of aesthetic rejuvenation, the challenge, and sort of the evolution of where we were and where we are now.
Yeah, so skin rejuvenation. So some of those goals we have are we want to improve the skin texture and tone overall. We want to reduce those fine lines and wrinkles, reduce pore sizes, and obviously help to stimulate collagen and elastin and plump up the skin. Traditionally, we had, maybe the CO2 laser that had a little bit more dramatic results, but it was requiring 1 to 2 weeks of downtime. So I feel like we just keep evolving with the technology, and there's better things and combination treatments. I love combination. Anything in combination is going to work quicker and better than just one single modality. So I love combining treatments when it comes specifically when it comes to skin rejuvenation.
Yeah. And the best part about our laser, it's always doing skin rejuvenation. Always. Yep. So no matter what the patient is being treated for, is if it's acne, rosacea, melasma, they're still getting the rejuvenation aspects because of what it is doing with the water and the collagenesis and the neocollagenesis at the dermal level. So, and just a little side note, like the world was all about blowing your face up 20 years ago because we wanted to fry you, and they thought the more trauma, the better the results will be. And we are realizing that preventative is almost as important as corrective, and our laser is doing both at the same time. So it's working at the dermis, building collagen while going after targets to cause change. So it's a combination treatment as well as a specific treatment.
And then specifically, when you talk about the Neo and the Era, this we like to refer to as the reverse treatment, which is reversing the signs of aging. Both, when you're using the Neo, you're creating that superheat, you're creating an improvement in collagen and skin rejuvenation. And then with the Era, think of it as like, mowing the grass. You are eliminating the epidermis and creating new skin growth. So that combination together is amazing for, treating scars and wrinkles and skin imperfections. I will say, if you do not have the Era and you only have the Neo, there's so many things that you can do in combo with the Neo, like microneedling, chemical peels, and you can get, really great results with skin rejuvenation if you only have the Neo. So don't think that you can't do skin rejuvenation if you don't have both of these lasers, but together they are awesome.
Yeah.
Awesome. And with that, let's show sort of what a reverse procedure looks like from the very beginning to the end. And I think Jody, you could tell us about this.
And Jody.
So this was by far one of my favorite treatments I have ever done. So it was about a year into aesthetics for me. And you can see the before picture, especially around my mouth area. And mind you, this was during a training when we first brought the Era into Strela. And we only did partial face. So you can see here, there's no lines of demarcation with this. And we did one complete pass, not a whole lot of overlapping. But immediately after, you see the skin is vaporized. And then that next morning, you see all that erythema. And then over the next 3, 5, 7 days, that peeling happens. But yeah, these were by far 5 days after compared to before. I had smoother skin overall. I had a lot of PIH from acne, whether I picked it or not. It always developed into PIH. My pore sizes were reduced, my fine lines. But yeah,
if Jody's trained any of you and you've seen her skin, it is gorgeous.
Thank you. And no one ever believes me because they just think that I have nice skin, and I have to pull out my before pictures and they're like, oh my gosh, you didn't really have nice skin like you do now. So you can definitely reverse the signs of aging if you have the right tools.
Yes.
And with that, we can take a look at some of the existing technologies that treat rejuvenation and some of the differences between the approach and then overall the results.
Right. So, we kind of talked a little bit about this already, the downtime with CO2 laser, and then there's ultrasound like thermage and what's the other one that is, causing all therapy.
Yeah.
causing, it's the mechanical waves, and it's causing, a more focused, but it can be very painful and stuff. So, but yeah.
And they all have, and again, every laser has its place, but it is the one laser. If we're going to have a laser that can do everything and treat everyone, it can be a gateway laser, meaning it's your first laser that's going to start you off with this modality. It can be the add-on laser, but it can be the laser that is used for everyone that walks through your door, head to toe. Even the Era, you can ablate hands, you can ablate neck, you can ablate your do your décolleté, eyes. So it can be for specifics, but it can be for a consistent treatment also, a combo. But the comparison is depending on short pulse, long pulse. We do not need to numb with our Era. You do not need to have cooling going at the same time. People will feel the heat. You can put ice packs on, but it's about an hour max that you're uncomfortable. You don't need the vinegar soaks and the 3 days of ice packs on your face, depending on the ablation that you want. So again, the post-care is really important, and the downtime is really important. So there's a difference in that also.
And I always say moisturized skin is going to heal a lot better. So prepping your skin, and, if you are doing an Era treatment, post-care is huge, getting good quality skincare. And it's nice because with the Era, you can customize it. If someone wants a more, light peel compared to a real aggressive one, we can do that. And sometimes I will do like a light peel, maybe 3 light peels for, your lighter skin compared to one aggressive one, but they can do that, on a Thursday night or a Friday, and by Monday they're back to normal.
Right.
So.
Or you can be aggressive in just the perioral area and lighter on the rest of the face. And again, no demarcation. So you can make that even during your treatment lighter and heavier.
And from there, I think it's worth taking a look at. And to all of our viewers, I know we are going over slightly over time. So, but again, I think it's all very helpful and valuable information we're going over too. So let's take a quick look at the business case. And with that, obviously, like we kind of said, the Aerolase devices are very versatile. And from what we've seen, as you can see in this Venn diagrams here, is there is clear overlap between users and what they're looking for. Someone may be looking for acne and rejuvenation, and they may be looking at both at the same time, as well as one looking for acne treatments, and then it leads to other indications they want to be covered. Which I'm sure Dana, Jody, you both have seen that, where they come in for one thing, and before you know it, you're treating the toe fungus or so on too. It's just multiple options available.
They come in for their face, and all of a sudden they're asking about their neck, or they're asking about their hands, or, oh, it does hair on my lip. What about my underarm? So, yeah.
Or they're like, what's that little red thing that I have on my chest? It's a cherry angioma. They're like, well, I have them all over my body. I'm like, well, we can treat them.
Yeah. Let's get them.
And, with that, I think just as you both clearly laid out is the unique position of Aerolase, a comprehensive portfolio with both the Neo and Era for treating both medical and aesthetic conditions. The versatility, like we just went over, treating acne, melasma, rosacea, aging skin, and so many more. 36 plus FDA cleared indications. Probably the most important aspect is the ability to safely treat all skin types across all seasons. And the revenue growth that comes with it too. Obviously, the number one priority is treating skin and improving the patient's skin, making them feel good. But also, there is a business aspect to it too. And with the versatility, the ability to treat multiple patients, the limited downtime associated, the lack of consumables, there is, business growth opportunity clearly there as well. And with that will cap our presentation. Dana, Jody, thank you so much for all the awesome insight and real world scenarios you guys laid out for us. That was very, very cool. And let's go ahead and take some questions from the audience. And with that, our first question comes from Adina, and it's so what is your suggestion to treat acne with the laser? Maybe going into number of treatments. We did kind of go over this a little bit too, but maybe just a quick overview.
Sure. I'll take that. A lot of times, if someone's coming in, if they have a lot of active acne, I will bring them in. Sometimes I'll do like every 2 weeks because that allows, like, if they're going to have any purging that first week. And I also don't want to like use up all of their 6 treatments right away. So I kind of bring them in every other week until I see that active acne kind of calming down. Then I bring them in, every 3 to 4 weeks to really work on whether they're having like acne scars, PIH. But I also talk to them about combination treatments. So a lot of times with my acne clients, I will do like a chemical peel, or once the active acne has calmed down, I will pair that up with microneedling. I'll do Aerolase first, and then I usually numb, and then I go right into microneedling, especially for, any pitted acne, things like that.
Awesome. Yeah. And our next question comes from Daveen. Can you give us an idea how you price treatments to clients, acne, melasma, and how many average sessions recommended?
So what I do in my office is we don't have different prices for acne, for melasma, for hair removal. We do like a photo rejuvenation for the face. So it's one price for the face. Now, depending on the area, it's anywhere from, one treatment is typically $350 to $500, depending on where, you're coming from. But most of the time we are selling a package. I do a series of 4 or a series of 6. The only time I really do a single treatment is if they've never tried a laser before. They're just, maybe nervous about trying it, want to see how it's going to work with their skin. So they're already doing like a series of hydrofacials and they want to just add on an Aerolase treatment. I will, add that on, but then they're usually rolling that into a series of at least 4 or 6, depending on what their concerns are.
Great. And our next question, are all acne treatments monotherapy with Aerolase, or can you share a common regimen alongside Aerolase? I'm not going to attempt to pronounce that.
Yeah.
Doxycycline.
Doxycycline. So
Doxycycline.
if they are on a medication, topical, oral, you can do the Aerolase treatments with them. Sometimes if it is a photosensitizing medication, you might lower the energy a little bit if you know your patient, right? And you are on a higher mode of energy, which is the joules you're putting into their skin. But you can use it as monotherapy, but I would definitely have it as a series of 6 to start. But skincare is really important. What they are putting on their skin is super important. We will be treating the inflammation, but there are things that need to make the skin move to be really effective for acne. So they need to have something that is going to also treat the epidermis, especially if there's like hyperkeratinization where there's clogged follicles, things that really need to open the skin to help this acne kind of purge, move, and get them on the track of healing. But yes, if they're on doxycycline, if they're on a retinol, if they're on a topical clindamycin medication, they can continue that prescribed medication or topical treatment, and the Aerolase can be incorporated easily.
All right. So our next question, so it comes from Sean. Purging is a question that a lot of new users ask. How should users manage expectations with acne even before purging? And in fact, how would you go about managing expectations with patients for any treatment?
Well, with purging, before, education is huge when it comes to purging. So it's the bacteria has to come out. It's actually a good thing sometimes when they are purging. Usually if they're going to purge, it kind of clears up a little bit quicker. If I know that they're going to purge or they purged the last time, maybe I'll bring them in a little bit sooner, but also just managing expectations and making sure that they're on really good skincare. I love specifically hypochlorous. It's almost like a hand sanitizer for your face. It helps to kill that bacteria. So I have them spray it on several times a day, make sure that they're washing their face after the gym and,
icing.
Icing.
Sometimes icing. But purging is really part of acne. When I was in dermatology, our doctors would put them on medications and they would say, 3 months, I will see you back. But usually you're going to be worse before you're better. Accutane, you're purging, you're worse before you're better. New skincare, sometimes you're worse before you're better. So purging with acne is definitely a unfortunate but necessary sometimes response when we are trying to help heal the skin. So everybody is panicked about that, especially if they feel if they're under control. But acne can be in your skin sometimes up to 3 months before it even comes to a head. So we are seeing things with our laser that you might not be seeing on the top of your skin, but it's there. So education, like Jody was saying, is super important. And them understanding the patience that is needed to heal acne. Didn't happen overnight. It's not going to heal overnight, but we can get you there.
And especially even with like the Aera treatment, like sometimes people will purge after that, especially if they are acne prone, and then kind of educating on like what to put on your skin after so that it decreases that risk of that purging. So.
And we have a laser that could hit it if they purge, right? You come back in and treat those active pustules and cysts with some of our focus lenses to help it heal faster, which in the long run will help with the less chance of scarring. Right. So, because the faster we can heal it, the less chance there's trauma to the skin.
Awesome. And that concludes our Q&A section. Quickly looking at our second poll, we could see that, the biggest concern that our viewers were evaluating when they're looking to different laser technology, the number one was clinical efficacy and patient results. And number two was equipment cost and ROI. So we have tons of information available at aerolase.com, but what Jody and Dana just laid out, it's honestly clinical efficacy and patient results is the number one priority, and we hope that came across clearly through today's presentation. With that does conclude our final webinar of 2025. Jody, Dana, thank you so much for joining us and sharing all your insights. I've learned a lot myself, and I'm sure the audience did as well. To all of our viewers, please follow Jody and Dana on Instagram. Their emails are available on the screen, so reach out to them if you have any questions. You can always reach out to us at Aerolase at information@aerolase.com. You can visit aerolase.com to see more clinical studies, more before and after results, and more information on both the Neo and Aera. And with that, we hope to see you in 2026. And Dana, Jody, thank you again.
Thank
you.
Bye,
everybody. Thank you.
All right. Bye, everyone.
Bye.